They've been called magic drugs for aging eyes. What's the drug meant to your life?
A lot, because I can see.
Helping millions keep their vision with just a small poke.
Don't move, you'll feel a little pinch.
The drugs are supposed to come in sealed vials, directly from the maker. But packages like this have been showing up across the country, setting off alarm bells.
It's incredibly risky behavior. It's interfering with a commercial product, which is illegal.
Living on Newfoundland's coastline is something Marguerite McCarthy doesn't take for granted. Much more precious since she developed a condition called wet macular degeneration that could take away vistas like this for good.
Like, I'm looking at you straight on here now, and you're a bit blurry, but if I do this, you're clear.
McCarthy relies on injections of drugs in her eyes every 4 to 6 weeks, her only hope to prevent losing her sight.
What's there to live for, really? That's the way I feel. Like, I used to always say, I can't imagine if I lost a leg, but you know something? I think I'd rather lose a leg than lose my sight, because my sight is everything.
Wet age-related macular degeneration is a condition where new blood vessels in the back of the eye leak or bleed into the center of the retina, resulting in poor vision. There is no cure. But Lucentis and Eylea are two injectables, seen as miracle drugs, proven to help slow down the condition. These drugs come in sealed vials from the drug company. With a price tag of about $2,000, they are some of the most expensive drugs in the country. The ophthalmologist draws up a tiny drop in a syringe and injects it into the eyeball. It is to be used one time only on one patient per eye.
It was just glaring.
Ken Dix is a pharmacist in Newfoundland with over 30 years of experience. He helped write the federal government's policy on how to handle and dispense various drugs.
Just close your eye for me. Thank you.
He had a hunch after looking into how many injections were being done on patients in the province. The numbers just didn't add up. There were too many procedures and not enough product.
It's a 1-to-1 ratio because you need an injection to do the procedure. So it was easy enough to research how many procedures are being done. And then the question became, where are the products to match those procedures?
The only explanation, he says, was the vials were being tampered with and split. All vials contain overfill, an extra amount to make sure the right dose can be drawn. The drug manufacturers say any leftover is supposed to be discarded, but it's entirely possible to draw the overfill and create more doses.
I'm not in favor of that. I don't dose split personally.
Dr. Alan Crues is an ophthalmologist in Halifax. He performs these procedures daily and says dose split products can be dangerous.
Anytime you're drawing from a vial more than once, there are theoretical microbiological risks involved. Well, bacteria being introduced, into the compound and then creating inflammation or infection.
We have no idea if these products work. We have no idea now because the product integrity has been breached.
Documents from 2015 that Dix obtained under access to information backed his suspicions. Citing an aging population and surging demand for these drugs, the provincial government was in search of a cost-cutting deal. A pharmacy in Ontario offered to divide manufacturers' vials of the drugs and ship pre-filled syringes to Newfoundland and Labrador. Then a smoking gun.
There were no other markings, no gradients, nothing else on the syringe whatsoever.
Keith Morgan is Dix's lawyer who specializes in pharmaceutical law. A package of Eylea they got their hands on looked nothing like the real thing. It came in a tinted bag with a new expiry date and no brand name label. Morgan and Dix contacted Health Canada to come take the package and test it.
They reviewed it found that it was sterile and destroyed the sample, destroyed the product that we provided to them.
What did you make of that?
I was flabbergasted that, this was evidence of a in my view, was a regulatory offense. And they took it and they destroyed it.
CBC News contacted Health Canada about the matter. In an email, it says that due to the healthcare system's pressures, many rely on third parties to make and supply these drugs. It adds that Health Canada is exploring a regulatory framework to oversee outsourcing arrangements. So here's something else. More doses means more money. So who's pocketing that extra cash? Is it doctors, pharmacies, distributors, government? We simply don't know.
There's obvious commercial advantages. I mean, you're taking one product and creating 4 or 5 doses out of that one product.
The Newfoundland Pharmacy Board says, well, that's coming from Ontario, it's not our wheelhouse. They have full inspection powers. They could have done that, they could have seen the invoicing. They didn't really they didn't want to look, it appears to be, as to what was the background. Why was this happening?
The large-scale contract was ultimately called off. But Dix believes dose-split drugs are still flowing into Newfoundland. Provincial officials denied our interview requests. It seems the defunct plan was so secret that to this day, nobody is keen to talk about it. We've gone to the Premier, we've gone to the Minister provincially, we've gone to the Newfoundland and Labrador Pharmacy Board. All of them have said, nothing to see here, folks.
I told everybody I could, which is my obligation. I guess hoping that somebody would tidy this up for us, but that never happened.
It said everybody went to ground.
Everyone went to ground. Emails weren't answered, phone calls weren't returned.
Meanwhile, the distribution pattern Dix and Morgan have uncovered could be a blueprint for other provinces.
It's not just a Newfoundland issue. This is a national issue. It's one that we understand has tentacles all the way across Canada.
And that's why for Dix it all comes back to patient safety for all Canadians.
I've been at this 32 years, and I've gone to work every day trying to do what's in the best interest of my patients. Once you know, you can't unknow, and then your obligation is what do you do with it?
Marguerite McCarthy, who used to get Eylea injections, is left with a lot of questions.
Makes me very angry. Makes me very angry, very upset. If it's from the hospital, if it's from some pharmacy outside, I have no idea. We're not told any of those things. Well, I don't really ask, but I'm going to start asking a lot more questions now.
So, Chris, that's really interesting. Anything more you can tell us about Bayer's reaction to this practice of dose splitting?
When Dix complained, they reissued a directive. This was in 2022, saying that Eylea was not to be dose split. Now, they've begun taking matters into their own hands and issuing single-use syringes of Eylea. And we have also learned that they have filed a $15 million lawsuit against a different Ontario company, alleging that the company was dose splitting Eylea.
All right, Chris O'Neill Yates in St. John's, thank you.
You're welcome.